Today, Dr. Judith Koenig of the Ontario Veterinary College is going to discuss the progress of a study pursuing the use of stem cells for treating horses with osteoarthritis of the fetlock joint. Dr. Koenig divides her time as a practicing equine veterinarian and researcher at the OVC. Welcome, Dr. Koenig, and thank you for joining us.
Thank you for having me.
First of all, refresh our memories on the advances in stem cell therapy for treatment of damaged joints.
So we have recently shown in a study that when stem cells are injected into joints that have acute inflammation, that they help to decrease the inflammation in the joint. There's been research out in other species that has shown that it is helping perhaps with pain management, but the pathway by which these cells work is really not understood.
Can you explain the purpose of your study that compared injecting saline into joints to injecting stem cells derived from equine umbilical cord blood?
Yes, so this study is actually two different studies. One study that we did first was a safety study where we look to use stem cells from a single donor, meaning one foal at birth, the stem cells were harvested from the umbilical cord. And then we used multiple foals, and we pulled that and expanded it and froze it. And these type of cells from multiple donors, we investigated in a safety study because it's much more practical if you have a cell bank to use these cells, and you can treat more horses with it. And it's off the shelf. Like you basically say, I want that for treatment, and you just thaw it out. That's the idea behind it. So we did a safety study where we injected it in research horses to make sure we don't have any unwanted side effects. That was the first part, and those horses all were doing well with it. So we knew we could use stem cells from multiple donors, which is really important. And we saw that they didn't have a bad immune reaction. They had no systemic reaction to it. So that was good. And then we use it in a model where we create in standard breds little chips in the fetlock, in the ankle of the horse. And then we exercise them. And then we treat one group with stem cells and the other group we treat with saline. And then we compared the outcome. So that was one of the models. Those horses continued to exercise like normal horses would. They were running on the treadmill, and they were turned out in a paddock where they played and ran often more than they did on the treadmill. And the other study was looking in client-owned horses that have naturally occurring osteoarthritis. And we treated 15 of them with stem cells to see how they would respond or how their lameness would improve.
So, what were the results, and how did equine joints respond to the injection of stem cells from umbilical cord blood?
So what was important for us to see is if they can actually change the progression of the osteoarthritis that we created. And we followed these horses with MRI and with X-rays and with ultrasound and weekly lameness evaluations. And we saw actually that in the stem cell group, the signs of osteoarthritis improved. So we saw an MRI that they had less signs of osteoarthritis than they did in the saline group. And also we did the recheck arthroscopy. That's when you stick a little camera into the joint to actually evaluate what the cartilage looked like. And we saw that the horses in the saline group had more damage in the cartilage than the horses in the stem cell group. So that was very promising. We were very excited by that, and we have done the first 6 horses. It is a 4 months clinical trial, so it takes a long time. And we are planning to do the next 6 horses in the spring. And in the clinical trial in client horses, we only evaluated if the horses had any swelling or lameness after injection of the stem cells. We used 10 or 20 million stem cells in their fetlock, and they didn't have any swelling or any other adverse effects. And then at 3 and 6 weeks post-injection, they were free from lameness. So except for one horse, all horses improved by one lameness degree at least. So we were very excited by this finding. The stem cells worked really well.
What were the challenges of this study?
The biggest challenge for the osteoarthritis study, where we induced the osteoarthritis with a chip, was actually being consistent in creating the same size chip surgically in these horses, and also to have a consistent exercise routine. And it took a lot of manpower to conduct that trial because, exercising 6 horses every day, and then MRI needs to be done under general anesthesia. So each MRI takes half a day. So it was a long, everything was very, very time consuming. And a 4-month study duration for us that was the biggest challenge, really. And the person doing all the evaluation, the lameness evaluations, he was blinded to the treatment so that we don't get any bias, because of course we all want the stem cells to work. So he didn't know what the horses got. And then at the end, we had to evaluate all these data and score all the x-rays and MRIs and arthroscopy images and all that. So it's a very labor intensive study.
And what is next in the exciting world of regenerative therapies?
Well, I think our first step is to show that they are effective. And then, as I said, we will add 6 more horses so that we have a little bit more power behind the differences that we see, statistical power, so that we can perhaps show some significance. And then the next step is to evaluate, like we harvested some liner of the joint and some different samples, and also some of the joint fluid, and that all needs to be evaluated on a molecular level to gain a better understanding how the stem cells work. There was an old belief that stem cells would work by just regenerating the tissue that is damaged, but we know now that it's not. If you inject them in a joint, they make cartilage. We know that that is not true, but we know that they have an action that is uh, more mediated by what they perhaps secrete or in their presence, and that in the environment, that maybe their surfaces change or they stimulate other cells to do something. And that's something that they do. We would like to look a little bit closer. So we are going to measure all the different products that these cells might have, cytokines and things like that. We are going to measure in the fluids and analyze it.
Thank you, Dr. Koenig. Is there anything you'd like to sum up or mention in closing?
I want to really thank my research team, which was a group of vet students and animal science students, as well as a couple of PhD students, and actually also research students from different universities for being there. We also had some retired ag assistant that helped us with everything, and also the lead. So it was a really good research team, and I want to thank them. And I also want to thank the horses. We had some great standard breds that really, really were well behaved and great animals to work with. They are now happily living in green pastures in our kill.